SPs, please prepare. Examinees, you may begin your first patient encounter.
Come in.
Mr. Robertson, I'm Dr. Kiran Sultan, I'm the physician in the office today. It's nice to meet you. I'm here to ask you a few questions and do the physical examination. Is it okay with you?
Okay.
Okay, are you comfortable in the room, Mr. Robertson?
Yes.
Okay. May I call you Robertson?
Sure.
Okay. May I sit down and write while we talk?
Yes, sir.
Okay. May I please? I can place this paper. Okay, comfortable now? Okay. Okay, Mr. Robertson, how can we help you today?
I have burning pain when I urinate.
Okay. I'm sorry to hear about that. I'll try my best to help you, okay? And can you tell me more about what you have been experiencing?
It's just when I go to urinate, it burns. It's a burning sensation, pain and burning sensation.
Okay. You also have pain?
Yeah, just a little bit.
Okay. Okay. And how frequently are you urinating?
Normal, I guess.
Like before? Do you have no increase of
No,
frequency?
no change in
Okay.
frequency.
And do you feel like you can't hold your urine by the time you reach the seat?
No,
Or you are able to hold it?
Yes.
You have no accident? You had no accidents?
no,
Okay. And you also wake up in the night to urinate?
no,
Uh-huh. And have you had like similar complaints in the past?
no.
Okay. Do you have fever?
No, no fever.
Do you have pain in your abdomen?
No,
Pain in your belly?
no,
You don't have pain, okay. And you also have nausea or vomiting?
no.
Okay. And how's your appetite? Are you able to eat well?
Yeah, it's good. It's normal.
Okay. And do you have any back pain?
Back pain? No, no back pain.
And how's your urine? Do you find any blood in it?
No blood.
No blood?
It's just white, cloudy discharge.
Okay, it's cloudy. Okay, since how long have you having these symptoms?
It started about a week ago.
Okay. And how did it start? Do you know anything caused this?
No,
Okay. And you feel like these symptoms are getting worse?
no, it's been the same.
It's been the same. Okay. And is there anything that makes your pain, or the burning, something makes it worse or something makes it better?
No,
Have you taken anything for it?
no.
And how's your, may I ask you a few questions about your health in general? It will help me in making the diagnosis, okay?
Okay.
It will help me in getting more clues towards the diagnosis. And how's your, did you have any changes in your diet, the bowel movements recently?
No changes. It's the same.
Okay, and have you had any recent changes in your weight
Like-
loss or weight gain?
No,
And you said your appetite is normal, and do you follow a specific diet?
no,
Okay. And do you have any joint pains?
joint pains? No, no joint pain.
Have you been hospitalized previously anytime?
No.
Okay. Have you had any recent infections?
Recent infection? No, no recent infection.
Okay. And do you have any straining while you're urinating? Yeah, do you have to strain?
No,
Have you had any trauma?
trauma? No,
Okay. And do you have any rash?
no rash.
Okay. Now may I ask you a few questions about your past medical history? Is it okay?
Sure.
Did you have any similar complaints previously?
No,
Okay. And have you been diagnosed with any medical condition in the past?
no,
Okay. And are you on any medication? You are taking any medication?
no,
And are you allergic to any medication?
no, no allergies.
Okay. May I ask you a few questions about your family's medical conditions?
Sure.
Can you tell me more about your family's medical conditions?
It's normal, nothing,
Okay.
you know,
Anything
spectacular.
significant?
Nothing.
Okay. And may I ask you a few personal questions? I want to assure you whatever we discuss is going to be completely confidential, okay?
Okay.
You can relax and answer me, okay?
Okay.
Do you smoke?
No,
Do you drink alcohol?
no.
Okay. Have you ever used any tobacco product?
Anyone?
Any tobacco product?
Tobacco? No.
Okay. And are you sexually active?
Yes.
With whom?
With, you know, people here and there.
Okay. And so how many partners did you have in the last year, during the last year?
Quite a bit, a lot.
Okay. And were the male, or female or both?
Female.
Okay. And do you use condoms or anything for contraception?
Sometimes.
Sometimes. Okay. Have you had any discharge from your? Did you have any discharge? Urethral discharge?
Yes.
Okay. And since when are you having this?
It's since 1 week now.
Okay. And since these symptoms started, you had the same. Okay.
Yes.
Okay. And what kind of discharge is it? I mean the color.
It's white and cloudy.
And do you also have any lesions in your genital area, or is it just the discharge?
Just the discharge.
Okay. And do you have any foul smell in it, or it's just normal?
I don't know. No foul smell.
Okay. And did you find any blood in it?
No blood.
Have you ever been tested for HIV?
No.
Okay. And have you ever had any sexually transmitted diseases in the past?
No.
Do you use any illicit drugs?
No.
Okay. Mr. Robertson, I would like to recommend you to use condoms each time you have intercourse, since it can prevent you from several kinds of sexually transmitted diseases, and including HIV. Okay. And I would also recommend you to get tested for HIV, since you have a risk for HIV. Okay. And okay. So based on the information you have given me, you said you have pain, burning during urination, and also some urethral discharge that is since 1 week, and you have no fever, right?
No.
Okay. And you have no nausea and no vomiting, and the discharge is white in color, okay? And you also don't have any abdominal pain, right? And you had a history of multiple sexual partners, is that right?
Yes, that's
Okay.
correct.
So based on the information, now I would like to do the examination on you. Is it okay?
Sure.
Please allow me to wash my hands. Do you think you have any questions or concerns for me?
No.
Do you think we need to discuss anything that we haven't talked about?
No.
Okay. Mr. Robertson, could you please slide in for me? I would like to examine your belly.
Okay.
Help you. You can lie down.
Okay.
There are 5 minutes remaining in this patient encounter.
May I examine your belly? I will have to lift up your rib, okay?
Okay.
I'll try to protect your modesty, but are you okay?
Okay.
So first I would like to look at your belly to look for any abnormalities, okay?
Okay.
Which I don't find. Now I would like to listen to your belly, okay? I'm going to just warm this up so that you don't feel uncomfortable, okay? And now I'm going to press on your belly. First I'm going to do it lightly. Please let me know if you have any pain or discomfort, okay?
Okay.
Okay. Now I'm going to press in deeply. Please let me know if you have any discomfort, okay?
Okay.
Do you have any pain anywhere?
No.
Okay. Now, I can put this back. Please sit back. Okay. Now can I listen to your heart and lungs?
Sure.
Can I try your breath? Could you take a deep breath for me, please? I'm going to place this on your back.
Okay.
Can you take a deep breath for me? Again? Again? Again. Okay, thank you. Now, can I listen to your heart?
Sure.
Thank you. Okay, I'll try this one. Okay, now I would like to look at your hands or skin to look for any rash you have. Okay, I don't find any rash. Can I look into your mouth, okay? Can you see now? Thank you for letting me do the physical examination. I'm sorry for what you have been experiencing. Okay, I'll try my best to help you. So, based on the information you have given me and the physical examination findings, I probably think you have some kind of sexually transmitted disease based on the risk you have with the multiple sexual partner. So, there could be other reasons even. So, I would like to do some blood tests and the test for the discharge, urethral discharge. Okay, and also do a pelvic examination, genital urinary examination for you. Okay, later on today. And once I get back the test results, I'll be able to make an accurate diagnosis and give you the appropriate treatment. Is it okay with you?
Okay.
Do you have any questions for me?
No, doctor.
Okay. It was nice meeting you. Thank you for your cooperation. Have a good day.
You too.